You're listening to Health Professional Radio with Wayne Bucklar. Today my guest is Dr Jerome Sarris. Jerome is a Senior Research Fellow at the University of Melbourne, and Jerome's just recently spoken at the Blackmores Institute Symposium. Jerome, welcome to Health Professional Radio.
Good to be with you.
Now, Jerome, I understand you were talking about complementary and integrative medicine in mood and anxiety disorder. What was it you were telling the symposium?
Well, look, we covered a range of particular areas, certainly pertaining to our NHMRC-funded research, which we're quite excited about, and it generally concerns the studying of various nutraceuticals, that is sort of plant or nutrient-based supplements, to treat a range of disorders, including generalized anxiety disorder, major depressive disorder, bipolar depression, as well as OCD.
Now, just for the sake of people who are not academic in backgrounds, NHHR.
Oh, sorry, NHMRC. So the National Health and Medical Research Council. So these are government-funded projects, which we're very proud of, because it does show, I think, our peers' commitments and the government commitment towards exploring some of these complementary and integrative approaches for mental health.
And that's competitive research funding, I assume. So
yeah, absolutely.
There's grounds for you to be proud if you get a grant from a body like that.
Yeah, well, certainly in today's competitive research environment, yes. No, very, very proud. So, some of the work we do, some of us in potential partnership with a company like Blackmores, the sort of more industry-related work, but we're especially proud, obviously, of government-funded research, just because it's difficult to get, but also I think it sort of gives a little bit of the stamp of approval in terms of the quality of the research we're doing at Melbourne University.
And Jerome, have you completed any of that research yet and published, or is it still in the early stages?
Well, look, we're still recruiting down in Melbourne and Brisbane. For example, we're testing a multi-nutrient formula to see if we can enhance people's response to antidepressants for treating their depression better, as well as another study which is ongoing looking at kava, which is a South Pacific medicinal plant to improve people's anxiety symptoms, as well as other nutrient work in the area of bipolar disorder and OCD. So, yes, they're at varying stages, our projects, but we'll certainly have some very good data, we hope, and results in the coming year.
Now, I understand that there's quite a bit of research around in the literature that suggests detrimental effects from unhealthy diets and from nutrient deficiency. What's the research say about the counter? Is there much being published about the beneficial effects?
Oh, look, absolutely. And I think that's what's exciting about it, is that there's a relationship shown cross-sectionally. In other words, just looking at the quality of people's diets, very good traditional whole food diets versus sort of unhealthy, processed, more westernized diets, and showing that at both ends of the spectrum there can be beneficial and protective effects, or there can be, as you said, detrimental effects. Absolutely. So that's an area I think which is certainly quite exciting, but also longitudinal work. So showing that some data showing that the quality of a person's diet may predict down the track the level of depressive symptoms or anxiety symptoms that they may have later on.
That's interesting. The whole idea of complementary medicine has come along dramatically since my days in clinical work, which was about 40 years ago. Way back then, if someone was eating fish for health reasons or taking fish oil, it was kind of a bit hippie-ish and a bit weird. And now as a 60-year-old, my doctor prescribes medication and then writes on the bottom of the script plus fish oil. It's just become a routine part of the general practice, I think.
Yeah, look, it has, and I think that's what's good. Look, we still do need to obviously do a lot more work, but I think what's encouraging is high quality research being conducted to substantiate some of these interventions, such as omega-3, or in fact in some cases to clear people's minds in terms of some things which may not work. I think that's an issue equally, that there are some spurious treatments, and it's always good, I think, to have sometimes good studies saying, no, look, we can't use this for this. As it can be equally as important.
And you mentioned Blackmores before. We've done a number of stories with them, and it is nice to know that they are very heavily involved in credible academic-based, evidence-based research.
They are, yes. I mean, look, don't get me wrong, as an academic, we're always encouraging them to invest more. There's no doubt about that. However, what they've done with the Institute, I think, is fantastic. And also, I think they've appointed a chair, a professorial chair at Sydney University, or at least shortly they will be. So that's very encouraging, their investment in that area.
Yes. And did the symposium take well to your message when you were there?
Oh, look, I think it did. I mean, we start. I think the main body of people that I think were mainly pharmacists.
Yeah.
So it's an interesting position because obviously their background very much aligned or understanding of pharmaceutical medicines, but they realise their bread and butter to a good extent nowadays does come from some of these, the sales of these supplements. So they're very interested, very, very keen to learn more. My position's always it's about the best of both worlds. So the strengths of, judiciously used pharmaceuticals, as well as evidence-based supplementation where required. So sort of, I guess, having that integrative approach tends to go over quite well with the sort of mainly sort of pharmacist audience.
And that integrative approach to medicine is becoming a trend, I think, in quite a number of countries around the world. It's almost starting to look like another specialty in some places.
Yeah, look, it is. I mean, I think that that's something which is an ongoing evolution. Who's to say that, maybe the paradigm in, 20, 50, 100 years will have changed, that there is only integrated medicine, that it isn't just sort of, one or the other. At the moment, it's sort of still, I guess, coalescing in terms of what it is, whether it is a distinct field or whether it is just the coming together of two different fields, or whether it is the evolution of medicine, intrinsically as it is.
I'm in conversation today with Dr. Jerome Sarris, who's a Senior Research Fellow at the University of Melbourne and who's just recently addressed the Blackmores Institute Symposium. Jerome, if there is a misconception about your work that drives you nuts and keeps you awake at night, what is it?
Jeez, honestly, I've never been asked that question. I don't know if I feel too worried about in terms of not being understood. I mean, I guess we're proud in the work we do in the sense that, we try to, I guess, draw from traditional knowledge. With my background, certainly having an understanding in plant medicines and nutritional medicine and lifestyle medicine, sort of using, I guess, that traditional knowledge, but then applying it under sort of, I guess, rigorous research models. And we also, for example, look at genetics, pharmacogenetics, the individual genetic differences between people, how they respond to these particular medicines, as well as neuroimaging, so we'll image the brain, also sort of looking at those effects. So we do apply pretty rigorous science. So I feel covered from that point of view. I guess the main issue, I guess, going into this integrative complementary medicine field is you do worry whether you'll be taken seriously and whether, the medical fraternity will be a bit critical and judgmental. But I haven't found that. Maybe potentially things behind my back, but look, it's been generally very supportive, the industry. And I think that for me, if you are doing good quality science, hopefully, and, you're enjoying your job and you're passionate about it, there's not a lot which sort of keeps me up at night regarding that, except to say that there's just a lot going on. And, you're always thinking about new projects or what's going on with the existing ones or all sorts of crazy ideas. So I think that keeps me up. But, look, it's generally all very positive.
Well, Jerome, thank you for dealing with my difficult question. We should call that section Questions Without Notice. Congratulations on your funding. That's great to hear, and we look forward to chatting to you again when you've got some results that we can talk about.
I'd be more than happy to. Thank you for having me.
If you just missed my conversation with Dr. Jerome Sarris, Senior Research Fellow at the University of Melbourne, the good news is we have a transcript for you on our website. You can also hear an audio archive of this interview on YouTube and on SoundCloud, and both the transcript and the links to the archives are available on our website at www.hpr.fm. My name's Wayne Bucklar. You're listening to Health Professional Radio.